Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. To use restraint alternatives and create a restraint-free environment, review the patient's care plan and observe his physical and mental status. Orient the patient and family to the surroundings, introduce them to the staff, and explain what you will be doing. As much as possible, provide the same caregivers and volunteer companions for the patient. Encourage family members and friends to stay with the patient as desired. If possible, place the patient in a room that is easily accessible to caregivers. To help the patient further, make sure that he is wearing his glasses, hearing aid, or other sensory aid, and that they're functioning properly.
It's real important that we leave those on for safety so we prevent any falls when you're up and around the room.
Okay.
Did you guys bring anything else from home that you would like to put up in the room?
Yes, I have a few things here.
Provide objects that are meaningful and familiar to him, such as a calendar, radio, or family photos.
On the bed table here.
And this is a calendar, maybe then you will know what the month and
okay, I'll get a thumbtack and get that put up for you right away.
Okay, thank you.
Okay.
During the patient's stay, meet his basic needs, such as hunger and toileting, as soon as possible. Provide regularly scheduled ambulation, chair activity, and toileting, but plan activities so the patient has long, uninterrupted periods throughout the day. For a confused patient, use a monitoring device, such as an ambulation, bed, or wheelchair alarm to help ensure his safety. Because many types of alarms are available, follow the manufacturer's instructions for use. When using this style of alarm, measure the patient's thigh circumference just above the knee. If his leg circumference is less than 18 inches, use a regular size device. If it's 18 inches or more, use a large size.
Inches. I'll have to go and get that and I'll be right back with it, okay?
Okay.
Test the battery and alarm by touching the snaps on the battery to the snaps on the leg band.
Your leg is flat or laying in bed. If you were to stand up, it's going to sound. And then we'll come in and remove it. So what I'm going to do is slide this on your leg.
If the equipment is working properly, apply the leg band just above the patient's knee.
Above your knee. I'm going to have you bring your knee up. I'm going to place it on.
Snap the battery securely in place. Explain that the alarm will sound unless his leg is kept horizontal.
It'll sound. Let me come in and remove the battery.
When assisting the patient with ambulation, deactivate the alarm by unsnapping the battery from the leg band.
Miss Thompson, I don't need you to be bothering that. See, your treatment's going through, so I'm going to kind of
To minimize distress, position catheters, tubes, and drains out of sight. You may also use camouflage by wrapping the patient's IV site with a stockinette or bandage, applying undergarments when a urinary catheter is in use, or covering abdominal feeding tubes or drains with a loose abdominal binder.
What I'm going to slide this stockinette over your arm to kind of help protect that. And it reminds you to help not play with it.
All right.
That's not too tight now, is it?
No, that's fine.
Okay, is there anything else I can do for you?
No,
while I'm here?
nothing right now.
Okay, thank you.
Thank you.
Mrs. Thompson, I'm going to give you a massage to help.
In
relax
addition,
you.
use stress reduction techniques such as a back rub.
Massage is a good thing whenever you're all weak and.
Also use diversional activities such as puzzles, games, movies, reading materials, or an object to hold. Make sure that it's an activity the patient enjoys.
For you.
All right, thank you.
What are you going to play?
Solitaire.
That sounds like a good game.
If needed, use a wedge cushion in the patient's chair or wheelchair. This cushion is thicker in the front, which discourages getting up without assistance. Or try a better chair alarm, which alerts staff when the patient tries to get up without help. Use other restraint alternatives as appropriate. For example, use a low bed, or make sure that the bed is in the lowest position. Use partial bed rails rather than full side rails as ordered and permitted by facility policy to prevent the patient from rolling out of bed without restraining him. Place a floor cushion next to the bed to decrease injuries if the patient falls when getting out of bed. Post a barrier such as a stop sign on the door to discourage a confused patient from wandering. Or try a wheelchair or chair alarm, which alerts you if the patient slides forward or tries to get up without help. As part of using restraint alternatives, follow the instructions of the charge nurse or other therapy team member regarding appropriate activities to give the patient stimulation and exercise. As part of your follow-up care, observe the patient's behavior towards staff, visitors, and other patients. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.